Now, one thing that the COVID-19 pandemic has shown us is how suddenly hospitals can become overwhelmed with patients. Architects have now also started looking at how health facilities can be better designed from scratch and modified to be more efficient should the world find itself in this position again. Joining me now to discuss this further is Paul Hopkinson from BlueDot Architecture. Paul, good evening, and thank you so much for your time on the Pulse today. It's quite interesting because one doesn't really ever think about how a building is built could make it more efficient, especially hospitals. I can't imagine them being different to what they already are.
No, thank you. Thank you for having me, and good evening to all. Yes, I mean, this is a question now that has basically, come to the fore in that. But, when it comes to the design of hospitals, generally hospitals are designed. They're designed with there is flexibility basically built into hospitals. But the thing is that a generic hospital or your general hospital that you're dealing with, it's based on basically on population numbers and disease profiles and things like that. And you can predict sort of growth within it. And that's where the flexibility is built into the hospital and that. Whereas sort of a pandemic, it's, the numbers, it's very difficult for hospitals to cope with those numbers because hospitals generally, if you break it into two sort of basic sectors, it's an elective care where you elect, so it's a slow growth and you can plan it. Whereas sort of the pandemic, it's a radical implication for a hospital, and it's completely unplanned, and you don't know, how many numbers you are dealing with, through the epidemic. So, hospitals themselves, we're going to have to relook at, how one deals with this.
When one looks at space, and again, within the existing hospital infrastructure rather, it seems to be finite. So when you bring up this idea of how they can be flexible to accommodate more numbers, does that mean that the whole design of hospitals perhaps will need to change going into the future?
I think that's something that needs to be tested. You see, the problem with hospitals, as I mentioned, it's planned growth. So, the infrastructure, it's not just about your clinical spaces where you're treating patients and so forth. It's also, there's a lot of support spaces that basically make hospitals functional sort of units. And, when you're dealing with a general hospital, that can all be planned, and, the size and the cost of hospitals are, it's enormous. They are very costly buildings to put together. So one needs to look at, I think, the hospital per se as it is, the flexibility. Yes, there can be improvements on it, but I don't think the hospital as a unit will ever be able to deal with a pandemic. So one needs to look at, the alternatives, almost let's call them plug-ons or bolt-ons, that one can basically associate with a hospital to deal with the numbers. But they don't necessarily have to be, physically plugged onto the hospital because, a pandemic as such is, first of all, is one needs to look at the prevention. There are sort of pointers that come up to say, look, this is en route and we're going to have to deal with this. And then it's a process. It's most things, it follows a process. So one needs to look at the overall problem and then break it up into smaller bites that you can basically deal with and understand what you can deal with sort of as a preventative measure. Then what you need to do as basically, where you're doing your testing and so forth. And, all those are flows, and those flows can be, you have a positive and a negative reaction. So if there's a negative reaction, those people don't necessarily have to attend hospital. If you have a positive, you can have almost like a triage where you can then also ascertain from patients, what is the implication for that particular patient? Well, do they have mild symptoms? Are they going to recover? Do they need to have a period of quarantine and then they can leave and they can basically rejoin society per se? And then you're going to have a number of them that are going to have to then, move on to another step where they could then potentially have to go into a hospital or a specialized facility that can deal with, the symptoms, that they are showing. So it's a difficult one at this point in time.
So, Paul, if I'm hearing you correctly, it not only means breaking down perhaps the access to services that one can have in a single building, but it also talks about breaking down the actual infrastructure of the building. Are you thinking about something like what we have with the mobile classrooms? You know, if there isn't enough space in a school, they'll quickly bring in some mobile classrooms. Are those some of the solutions that you're looking at?
Yes. You know, so if you look at it, because also, you know, we have COVID-19 now as a pandemic, and there's certain symptoms, and, you know, there's certain outcomes of it. One doesn't know, you know, what the next one may be. So it's, you know, in a very simple, if one looks at master planning of a hospital, hospitals generally, you know, they're building and they get filled up with huge amounts of parking or space around them, and some unfortunately don't have this. So you look at European hospitals, you know, it's a more high-rise type hospital. They don't use sort of vehicular transport, it's more public transport or drop-offs and things like that. So it's spaces, it goes right the way back to, and it's not just health architects, is one needs to look at spaces that you can populate and